So here we go.
Okay.
Hi, Ruby. My name is Olga Rybakov. I'm a student nurse practitioner. I'm glad you're here today.
Hi, Olga.
Are you enjoying your summer off work at the school?
Oh, I was, but this week's been hard.
What was hard about this week?
Well, just kind of out of nowhere, my stomach started hurting. My stomach hurts.
So this is the problem that brought you in today?
Yeah, my stomach hurts.
Yeah. Can you tell me how you feel about the problem?
Well, I'm worried. I don't know what's going on. It's started like about 12 hours ago, and it just hasn't gotten better.
Okay. Do you have any ideas what might have caused the problem?
I don't. It was just kind of out of nowhere. It started hurting right above my belly button about 12 hours ago. And then it kind of moved right above it for a little bit. And then it kind of settled and over on my right side down towards my hip. And it just stayed there for about 6 to 8 hours. So it just hasn't moved since then.
Does this problem affect your daily function?
Yeah, I can't work. It's hard to get comfortable.
Okay. What are your expectations from this encounter with me?
I hope you can help me figure out, what's going on and maybe we can fix it.
Okay. Let's talk a little bit about your main symptom. So would you say that your main symptom is the pain?
Yeah, definitely. Okay. The pain.
I know you talked about it a little bit, but in detail, where exactly is it?
So it's kind of below my belly button on the right side.
Mm-hmm. And you said it radiates?
No, it doesn't radiate.
It's just moved?
It moved. It started kind of in the center, and then it went up a little bit, and then it kind of moved where it is now, and it's just stayed there.
What is the quality of the pain? Would you say it's sharp or throbbing or dull?
Sharp. It's sharp.
Okay. And if we were to put the pain on the scale of 0 to 10, what would be the intensity?
Ooh, I would say 7. It's a 7.
Okay. And when exactly did it start?
About 12 hours ago.
Okay. And how long does it last? Did it last this whole time? Or did
It's been about the whole time.
Not intermittent. Okay. What was the situation where the pain started?
I was just at home, not doing much of anything, and it just started.
Okay. So just at home, you were not using anything, any new cleaning products, for example, nothing new that you can think of?
Nope, nothing new.
Okay. What does anything make it feel better or make it feel worse?
Yeah, so it gets worse when I'm walking or when I do quick movements. And a couple of times I've coughed, and that makes it worse too.
Okay. Have you tried any treatments for the pain?
No, but it does feel better somewhat if I lay on my back and I pull my knees up. If I draw my knees up a little bit and just lay very still, it feels better than when I'm up and walking around.
Okay. Have you tried ice or a heating pad, anything like that?
No, not yet.
Okay, so just lying on your back and pulling your legs in helps a little, huh? Do you have any additional symptoms that go with the pain?
Well, I did throw up a few times.
Okay. Vomiting. Are you nauseated?
Maybe. But I did vomit 3 times in the last about 4 hours.
Okay. Are you able to eat?
No, I don't have an appetite at all.
Okay. That's for the last 12 hours, correct?
Yeah.
Okay.
Well, I did have some saltines.
Okay.
But that's it. I can't eat any other food because I'm not hungry.
Can you describe the pain in your own words for me?
Sure. It's just a sharp, stabby pain.
Okay, sharp and stabbing. Okay, well, I appreciate you sharing all this with me. We're going to talk a little bit more about your history, and then we will definitely talk more about your problem right now. Do you remember any childhood illnesses that you may have had?
I don't remember any childhood illnesses.
Okay.
I was a pretty healthy kid.
Okay. How about adult illnesses?
Well, one time I had belly problems that were pretty bad, and about 15 years ago. And then I got a surgery, got my gallbladder removed.
Okay. Have you had a history of gastroesophageal reflux, GERD?
I don't know what that is, but
Okay.
I have been taking some medicine for the last month for some burning, if that's what the same thing is.
Yes, the burning, and then waking up at night.
Yeah.
Because of the burning. Okay, so have been taking medicine for a month. Do you have any ulcers or a diagnosis of ulcers in your stomach?
No.
How about inflammatory or obstructive bowel disease?
No.
How about diverticulitis?
No, I don't know what that is.
Okay. Something in your intestines?
Nope.
Okay. How about history of pancreatitis, problems with your pancreas?
No, no problem.
And you're not a diabetic?
Nope.
And you talked about surgery to get your gallbladder out.
Mm-hmm.
How about problems with your liver?
No, not that I know of.
Okay. Any history of hepatitis?
Not that I know of.
Okay. Have you had history of appendicitis?
I don't know what that is, but not that I know of.
Your appendix?
Yeah, I've never had problems with my appendix.
Okay.
That I know of.
History of urinary infections? Kidney problems?
Mm-mm.
Okay. Kidney stones?
No.
So outside of the gallbladder surgery, have you had any other abdominal surgery?
No.
Okay. How about trauma or injury to any abdominal organs?
No.
Okay. Have you ever been in a car accident?
No.
Okay. So outside of the surgery for gallbladder, have you had any other surgeries in your lifetime?
Nope, that was the only one so far.
Okay. How about past hospitalizations? Have you stayed in the hospital overnight?
No.
Okay. When was your last menstrual period?
I'm not sure. I don't keep track of it.
Okay. Was it recent, within last month or two?
Maybe.
Okay. When was your last blood pressure taken before today?
Oh, I don't know.
Do you see a doctor regularly?
No.
Okay. So do you have a primary care provider?
I think I'm assigned to one on my insurance, but I never go to the doctor very much unless something's wrong.
Okay. What kind of medications are you taking?
Well, I was taking that medicine for the burning, which I think is called Zantac.
Okay.
I have the bottle here. It says Zantac. It's 150. It says 150.
Mm-hmm.
And then I've been taking it twice a day.
Twice a day. Okay. Thank you. Are you taking any other medications?
No.
Any supplements, vitamins?
Nope.
Nothing herbal?
No.
Okay. So just that one medicine. Okay. Do you have any allergies to drugs, medicine?
Not that I know of.
Okay. Any food allergies or environmental allergies?
No, I'm lucky that way.
That's great. Yeah. Let's talk about family history a little bit. Have your father or mother had any abdominal issues, diagnoses in their lifetime?
Let me think. No, my dad's pretty healthy.
Mm-hmm.
And my mom's got some problems. She's got high blood pressure and diabetes, but she's never had any stomachy kind of problems that I know about.
Okay. Has any one of them had history of appendix problems, having their appendix taken out?
I don't think so.
Okay. Are both of them still living?
Yes, they're both still alive.
Okay. How about grandparents? Do you remember anything about your grandparents?
Not much. But
If there's something that you remember, what would that be?
Well, they both seem pretty healthy, and they're no longer here, so I don't know much about their health. I could ask my mom and dad, but
Okay.
I don't know much about their health.
Okay. How do you know if anybody in your family had a history of appendicitis or appendix being taken out?
I don't think so.
Okay.
Is that what you think this is?
I'm just trying to go through your symptoms and all the possibilities. And sometimes family history helps out with with getting a certain diagnosis. So we look at that carefully. So no other hereditary disorders that may affect your stomach, your abdomen?
I don't think so.
In the family. Okay. Let's talk a little bit about your social history and your personal history. Are you married?
No, I'm not married.
Do you have children?
No, no children yet.
Do you live by yourself or with someone?
I live by myself.
Do you smoke?
I do smoke.
How much do you smoke?
I smoke about 10 cigarettes a day, about half a pack.
Half a pack a day. And how long have you smoked that much?
Oh, let's see. If I'm 35, so for 10 years.
Okay. So yeah. 10 years.
Mm-hmm.
Do you use alcohol?
Not really. I do drink a glass of wine with dinner every night, but that doesn't really count.
Okay. A glass of wine is how much? How many ounces would be in your glass?
Oh, I don't know. Maybe half of the wine glass.
Okay, about 5 ounces or so?
Something like that, yeah.
Okay. Do you use any drugs?
No.
Okay. Any substances that are either legal or illegal?
No.
Okay. Have you traveled recently to a foreign country?
No, I wish.
What kind of work do you do?
I am a elementary school counselor.
Okay. So. Are there any occupational hazards that you can think of that you're concerned about?
Nothing out of the ordinary other than I'm around sick kids pretty frequently, but my body's pretty used to that by now.
Okay. Build up great immunity.
Yeah.
Let's talk about your stress level. Do you consider yourself a person who stresses out easily?
I don't think any more than other people.
Okay. How do you cope with your stress? How do you manage it?
Oh, I like to talk to my friends and take walks,
Okay.
things like that.
Now let's talk about what you eat.
Okay.
If you were to think about 24 hours of what you would eat in 24 hours, say before the onset of your pain, can you give me the full recall of what you ate?
Geez, that's hard to remember. So maybe some cereal for breakfast the day before, and a sandwich of some kind. But that's all I remember, and I'm guessing because I don't actually remember.
Okay. Okay. All right. Let's kind of talk about your general health.
Okay.
Did you have a recent unexplained weight loss or weight gain?
Not that I don't think so. My clothes fit the same.
Okay. Do you have any generalized weakness?
Well, I feel a little icky from not, feeling good for a while.
Okay.
So,
And
yeah,
I did notice from the vital signs that your temperature is slightly elevated. Have you been running fever?
Yeah, I don't own a thermometer, but I've been feeling pretty warm. Yeah.
Yeah. Do you have generalized fatigue or loss of energy?
Well, it's hard to tell if it's from whatever's going on or just because I can't sleep because I'm in pain.
Okay, and this is just recent. And
Yeah.
before the onset of pain, you did not have any of these symptoms?
Right. I felt normal before.
Okay. Yeah. Do you have any pain in your sides where kidneys would be?
Where are your kidneys?
They're in the back, kind of in the flank region.
No pain back there.
Okay. So, and the pain you said started up on the right side or above your umbilicus and then moved down?
Yeah, it
Right.
started kind of in the middle by my belly button, and then it moved up and then down. Yeah.
Okay. Do you have excessive gas?
No gas.
Okay. We talked about heartburn. You're taking medicine for that. Any indigestion?
No, but I just don't feel hungry.
Okay.
Just don't want to eat.
Can you chew okay if you were to eat right now?
Yeah, chewing's okay. Just the thought of eating is not good. Yeah.
Okay, and we talked about vomiting. And you had the changes of appetite. Any changes in bowel habits? Have you had a bowel movement since?
Let me think about that. Because I didn't think so. Oh, I did. I did have one at about 10 o'clock this morning, but it was normal.
Okay. So let's talk a little bit more about your bowel habits before this happened, before this pain.
Oh, and I'm wrong. I actually haven't felt warm. So I'm surprised to hear you say I have a temperature.
Oh, okay. You haven't felt warm. That's good to know. So before the onset of these symptoms, have you been constipated?
Nope.
Have you had diarrhea?
Nope, no constipation or diarrhea. So
any pain with bowel movements?
No. The one this morning.
Any blood with bowel movement or black colored stools? What is the color of your stool normally?
It's just regular brown.
Okay. And have you had any, have you noticed any yellowing of your skin or the whites of your eyes?
Oh no.
Okay. Any
That
itching of
sounds
the
scary.
skin?
No.
Okay. Any dark urine?
No. It's light
Have you
yellow.
have you been drinking normally?
Uh, yeah, I've had some Powerade and some water,
Okay.
mostly in the last 12 hours, and then the saltines, and that's
Okay.
it.
So no problems with urination?
No.
Okay. That's normal. That's great. Do you, so before the onset of these symptoms, do you leak urine when you're coughing or you're straining?
No.
Okay. And I'm done with all the questions that I had for you at this point. There is one more question, though, that's really important. Can you tell me what matters to you today?
Oh, I just want to know what's going on so I can fix it.
Okay. Okay, that's a good concern right here, and we're going to be working on doing something for your pain, and just I kind of have ideas about what you have going on, and we'll take good care of you. Okay, Ruby?
Oh, so grateful. Thank you.
You're welcome.
Nice job. Very
Thank you
thorough.
so much, Stephanie. Well, yeah, I didn't want to miss any of that secret
No,
history.
it's great. Well, and they give you so little,
Yeah, I know it's hard.
Wasn't a lot there. Yeah.
I'm going to be up next as a patient. I'm like, oh my goodness, what's going to happen now? Got to get the creative side out.
I know. I talk to people all day, and they never know their temperature and don't own thermometers.
Yeah,
They
yeah.
have no idea.
I bet. That's something that I have not done much of in my career, just because my patients are mostly asleep.
Yeah, your patients are out. Yeah.
Yes, somebody else does all of the questioning and stuff before they hit my room. So this is something that I'm going to be practicing for sure.
Okay. All right, let's switch. You did a much more thorough job than I think I was intending to do. So maybe I'll be inspired to be so thorough. And my name is, oh, your name is Ruby? Rose. You're Rose. I'm Ruby. Okay. Hi, Rose. I'm Stephanie. I'm your student nurse practitioner.
Hey, Stephanie.
It's really nice to meet you. What brings you here today?
Well, my head hurts.
Oh, no. Sorry to hear that. Can you tell me about your head pain?
Well, it's a really, really bad headache that feels like intense pressure from my right temple, and it moves across my forehead like my head is being squeezed by a vice.
And when did that start?
Started suddenly 6 hours earlier.
Okay. Did anything happen before your headache started? Did you hit your head?
No, I did not. I was actually just resting.
Okay. So you said it starts in your right temple and moves across your forehead?
Yes.
Okay. If you were to put that pain on a scale of 1 to 10, with 10 being the worst pain you can imagine, where is your pain right now?
Right now it's at a 6. When it started, it was about a 4.
Oh, so it's getting worse.
Yes, gradually over the last 6 hours.
Oh, no. Is your pain all the time or does it come and go?
It's all the time.
Okay. Do you have any changes in your visions? Do you see any spots or flashes or lights?
Yeah, I see flashes of lights in both eyes.
Oh.
I saw the flashes about 5 minutes before the pain started, and it started hurting.
Okay.
And now the bright lights really make my head hurt worse.
Oh, I bet. Have you noticed any changes with sound or sensitivity to sound?
No, I have not. Just the light.
Okay. Any nausea, vomiting?
Yeah, I vomited twice since it started.
Oh dear. When was the last time you vomited?
A couple hours ago.
Okay.
And moving my head makes the pain worse.
Okay. Does anything else make it worse that you can tell?
No, just the lights and the movement.
Okay. Anything that you've been able to find that makes it a little bit better?
Well, I did take some Tylenol, 1,000 milligrams, about 20 minutes after onset of pain, but I did not find any relief. It was still gradually getting worse.
Okay. Any new medications, new supplements that you're on?
No, nothing new. I just take I just take OCPs
Okay.
and extended cycle levonorgestrel. Oh, seasonal.
Seasonal. Okay.
Yeah, I've been taking it daily for last 6 months. And I did take it this morning, but that's it. That's all I'm taking.
Okay. Okay. And no new supplements of any kind?
No, nothing.
Okay. Have you felt pain anywhere else?
No, just my head.
Okay. I'm sorry to hear this. Have you had a headache like this before, or is this the first time?
The first time.
Okay. And have you felt like you've had a fever at all? Have you had a recent illness?
No, I have not.
Okay. Well, let's try and get to the bottom of this so we can try and make you feel a little bit better. It sounds like you're pretty uncomfortable. So that I can get a better sense of your full history, I'm going to ask you a little bit about some other parts of your health history and a little bit about your family as well.
Okay.
So you said that you've not had a history of headaches before.
No.
Okay. Have you had any problems related to your head in the past?
No,
other than headaches?
Nope.
And no prior trauma to your head from a car accident or a fall?
No.
Okay. No issues with dizziness, fainting, lightheadedness?
No, never had any of that.
Okay. And no problems with your ears, ear ringing, ear infections?
No.
No. Okay. What about your eyes?
No problems with my eyes.
Do you wear contacts or glasses?
No.
Okay. Okay. Anything going on with your belly? Do you have any problems with your stomach or intestines or?
No, I consider myself really healthy. I don't have any problems. This really surprised me.
Okay. And no prior problems with your liver, kidneys?
No, none of that.
Okay. Okay. And anything gynecological are you taking birth control pills just for the birth control, or did you have any endometriosis, fibroids, cysts, anything like that?
No, I really don't know why I'm on the birth control. I have not had any gynecologic problems.
Okay. Do you know the first date of your last menstrual period?
Yes, it was on February 7th of 2018.
Okay. Wow, that was a long time ago. But I guess the seasonal is keeping you from, if you're
Yeah,
taking it continuously. Yeah.
maybe that's why I'm taking it.
Have you noticed any unwanted side effects since you've started this medicine?
Not really.
Not really. Okay. That's good. Do you have any allergies that you know about? Any allergies to medicines,
Nope.
seasonal, environmental allergies, food?
Nope.
Okay. Okay. And what about as a child? Did you have any significant childhood illnesses? Chicken pox, measles, mumps, anything
I
like
don't
that?
remember anything. I think I was healthy.
Okay, healthy. And what about as an adult? Have you had any significant illnesses?
No, I have not. When I was pregnant and had my baby 8 years ago, I had preeclampsia.
Mm.
Yeah, but then my blood pressure returned to normal, and it's kind of been normal ever since.
When was the last time you had your blood pressure measured? Do you know?
I usually go to see the doctor on a regular basis, and that was about 6 months ago. And my blood pressure back then was 122/70.
Okay. Well, that sounds pretty good. That's normal. Have you just had the one pregnancy
Yes.
and one delivery?
Yes.
Okay. Okay, great. How about any surgeries in your past? Have you had any surgeries that you?
No, I have not.
Okay. Have you ever stayed overnight in the hospital for any reason other
I
than having
I
your
have,
baby?
yeah, when I had my baby, but that was it.
Okay. Okay. You have been pretty healthy. That's great. How about your stress level? How is your stress level these days? Would you
Oh,
say it's
it's fine.
manageable? Is it high for you? It's good.
No, it's not. I'm pretty chill.
You feel balanced and even?
Oh, absolutely. In
Do you,
every way.
do you do you have good support at home?
I do.
Okay. I see you work, so I know sometimes working mothers can lead busy lives.
Yes, but I'm used to it.
How about your parents? Are they alive?
Yes, my dad is alive and my mom passed away.
How old was your mom when she passed away?
My mom was 60.
And did she have any, significant health problems before that? Diabetes, high blood pressure, history of stroke or heart problems?
Well, she died from breast cancer,
Mm.
and she had migraine headaches that worsened after menopause.
And what about your dad? How old is he?
He's 70 years old, and he does have hypertension.
Okay. And that's it? That's the only
Yeah,
thing your
but
dad has?
even his hypertension is controlled with meds.
Okay. Any brothers and sisters?
No.
Okay, just you. Only child.
Me.
Okay. So I want to ask you about your lifestyle a little bit because all of this is important in trying to figure out maybe what's contributing to this head pain you're having.
Okay.
Do you smoke?
No, I don't smoke.
Okay. How about alcohol? Do you drink alcohol?
I don't drink any alcohol at all.
And any recreational drug use?
No, I don't do any drugs.
What about exercise?
I don't exercise.
Okay. Okay. So your mom had migraine headaches, but this is the first headache you've had as a 32-year-old that felt worthy of seeing a provider for.
Yes.
Right? Okay.
Mm-hmm.
And
Do you
no,
think this is a migraine headache?
it could be. It definitely could be.
Okay.
As your job as a school teacher, are you exposed to anything, chemicals or?
No, just a lot of snot. No, nothing that I can think of.
And have you recently moved jobs or homes where you'd be exposed to something different?
Nope.
Okay. Have you noticed anything, any like loss of balance or shakiness or numbness or tingling anywhere in your body since this headache started?
No, not that I can think of.
And what about you just overall? Have you felt extra tired or fatigued?
Not before this pain started.
Okay. And you said your mood's been okay?
Yeah, it's been all right.
Okay. And any changes in your weight that are kind of unexplained recently?
Oh, I wish I had some changes on the weight, but no, nothing.
Okay. Okay. Well, I'm sorry you're feeling poorly. We're going to do a physical exam in a bit, and maybe if that's all normal, we can discuss possibly what's going on and some treatments. I did notice that your blood pressure was a little bit elevated today. It was right at the border of being a little bit too high. So before you leave, we're going to want to take that again just to confirm it. And if it's still on a little bit on the high side, we might have you come back in a week or so we can recheck it. Sometimes it goes up a little bit just because people are nervous when they're in the doctor's office. But it's a little bit higher than we'd like to see it. Nothing, really significant, but I think that's all, right?
Yeah. I'm also married for 10 years.
Oh, I should have married for 10
So, you know.
So you have migraines, clearly. And I have an appendicitis, probably, right?
You found the causing factor.
Yeah. Well.
And do you exercise, by the way, Ruby?
No.
You don't. Okay.
I had so little information to give you. It was sad.
Yeah, I felt like I had a little more than you did, but yeah, it's kind of hard because you don't know what it's going to be, and so you just keep on going through as much as you possibly can. But it's good practice for both of us.
I maybe should have asked you about your diet, since diet can trigger headaches, like chocolates and cheeses and that kind of stuff.
Yeah, I don't like any of those things. I just eat oatmeal. No, I actually don't know what I eat.
Okay. Well, hopefully I didn't miss anything. When I saw neuro, I was like, oh no.
Yeah, I saw yours. I was like, oh, I'm glad I have the belly.
Well, I got really worried. I didn't think they would do it, but I was like, what if they make it like a mental cognitive thing or something?
Yeah. Oh, well, you did great.
Oh, thank you. This is what I do just every day.
Yeah.
This is all I do. So
you weren't stressing out about this assignment, huh?
Well, I mean, there's whole sections I don't do.
Yeah.
I do a much more condensed version of this when I'm dealing with people because I have their chart I'm looking at.
Yeah.
So I can already see their history. So mine's just like what is going on today. I don't have to go through their whole family and stuff. So
yeah.
I was worried I would miss like that stuff because I'm not used to doing it. So
yeah, I just had a list of things to ask because I knew I would forget things if I was going off memory.
Yeah, abdominal's hard because it can be, right, it can be the gut, it can be your liver, it can be your kidneys, it can be your uterus in women. It gets pretty complicated. So
yeah.
Those are some of my longest calls, actually.
The pelvic pain diagnosis.
Or even like abdominal, because kidneys can radiate, or and most people think their kidneys are down by their sacrums.
Way low.
way low. They don't know where they are. So well, it was really nice to meet you, Olga, and I appreciate you setting this up.
Yeah, nice to meet you too, Stephanie. So I think I know how to send you a link. So after we're done here, I'm just going to send it to you on Hangouts.
Okay.
Is that all right?
Yeah. I'll figure it out.
Yeah. Okay.
I can figure that much out.
If not, I can send it via email too, whatever works.
So I'm sure we'll overlap again. I'm going part-time, so I don't go full-time.
Okay. Are you taking just 2 classes?
Yes, and even that I'm finding pretty hard.
Yeah. Depends on the classes. I'm starting 3 classes in the fall, so.
And working?
Working part-time.
But still.
Yeah.
A lot.
So we'll see. Most of the class is probably going to do the same thing, so we'll all struggle together.
Well, it's always good to struggle with company. That's for sure.
Yeah. I feel like I can always switch to 2 classes later if it doesn't work out for me, but so far I think I can do it. I hope I can do it.
That's great. I've had a hard time with it, but I have a 7-year-old, so maybe that's fine. Yeah. Do you have any kids?
Oh yeah, I have 3 boys, 11, 8, and 6.
Oh geez, you really are busy.
My husband is very helpful though when it comes to everything kid related. So he just doesn't cook much.
Yeah. All right. Well, thank you again and have a great rest of your day.
You too. Thank you.
Bye-bye.